Summertime, and the living is easy, especially barbecues and picnics. But how will you keep your family safe with regard to food? Some tips on Health Talk. Hello, I'm Dr. Jay Noreen, and this is Health Talk. Summer is a great time of year, especially here in the high country. But in summer, there is some concern about food poisoning when it's warm. And of course, it is greater when it's warm. We're more likely to consume food that has not had the protection of refrigeration. That's what summer's all about. So ahead, some tips on avoiding the problems of possible food poisoning. Let me introduce Dr. Anne Marie Gloster of Appalachian State University's Nutrition and Healthcare Management Department. And from the Watauga County Health Department, we welcome Beth Lovett. Now, when we think about food poisoning or foodborne illness, as it's often called, what do we mean? How dangerous are these things?
They can be very dangerous. They cost our country the top 12 pathogens that generally, we come down with, a $14 billion loss.
Wow.
And close to 1,300 deaths, 9 million people sickened just from those top 12. There's many, many more that, if you really want to add all the numbers up, but it's extensive. We lose a lot of quality and healthcare costs and work and time.
Did you say $4 billion? Dollars?
14.
$14 billion.
$14 billion just for those top 12 pathogens.
It's hard to imagine.
Yeah.
Well, and I've read recently that there has been ice cream recall that was contaminated, and we've had the meat Jack in the Box, for example, a few years ago. That was a pretty serious problem. And I read someplace that if you add all the even mild types of illness where people are out for a day or two,
right,
it's as high as 48 million. Is that an exaggeration, or is that really correct?
No, that's accurate. And most of the time, as you know, Beth, people don't report. So they're sick, and because only one person gets sick, they don't necessarily, that doesn't count as an outbreak, right?
Yeah. Right.
So that could even be an underestimate, even because people don't report.
Exactly.
Wow, that's really impressive. Yeah. Well, how serious is it? We know that 48 million get sick, but sometimes that's an upset stomach for a day.
Right.
Is it more serious? Do people have to go to the hospital? I mean, how serious does it really get?
The last time that the health department was a part of investigating a foodborne illness in the high country, we had several folks hospitalized, about 15 folks ill. And these are kind of rough numbers, but of those, most of those made a visit to the emergency department. 4 maybe were hospitalized, and so it can be really serious.
And that's in what part of North Carolina where you had that?
Here in Watauga County.
In Watauga County, just in the county, there were people hospitalized.
Yeah, sure enough.
That's really impressive.
Your restaurants account for about 60% of the foodborne illnesses.
Okay.
We think about the grocery store, recalls like you're talking about, but a lot of times when they find those, they pull all the product, and so we don't have to worry as much. But when you have, again, we go back to the classic church picnic that you're kind of alluding to, and summertime activities, those, several people can be impacted at the same time.
So if it's 60% restaurants, that still means it's 40% at our picnics.
Right. Or other at home.
Private catering.
At home, private catering, But that's 40% is a lot.
Yeah.
That we ourselves have a fair amount
of control
to do,
over.
Control over,
That's
or
right.
prevention if we do it the right way, which we're going to want to talk more about what is the right way as we think more about this.
Yeah.
So from a public health perspective,
Sure.
What is public health's approach to it from your point of view?
Well, in big picture, what I think of a big picture public health, and your local health department is responsible for that, your population's health across the community. We protect our public from food illnesses largely by restaurant inspections. And we do inspect temporary food stands, food trucks, which are great, delicious food and great fun, but they're also permitted and inspected by the registered environmental health specialists at the local health department. And so we really are looking at food code specifics when we go through an inspection, and ranking those by risk. And food handling is, food temperatures, food handling are among the top issues that we are concerned about, and that really we should be concerned about it at home as well.
Yeah.
So we want to help protect you from food you don't have control of, but we want to make sure you're educated to know about the food that when you're preparing it at home, how to be safe as well.
Yeah, yeah. Well, when you say there are inspections at restaurants, what's inspected and what does that mean for us at home? What kind of things do you look for, and what should we be looking for at home?
Well, food temperature, holding at the right,
Okay.
if it's cold, keeping it cold. If it's hot, keeping it hot. And some of the most serious illnesses that we've investigated in public health over the last, say, 15 years that I've been in public health have related to just that. Cold has to be cold, hot has to be hot. The in-between time becomes sort of the danger zone. And so that's a real focus for us. When we go into an establishment, the first thing our inspectors will do will put thermometers in the various products, whether they're out on a buffet type situation or in the cooler. So that's one of the keys. I think the other big key is cross-contamination, and making sure that whether we're at home or whether you're in a restaurant setting, you're not storing raw meats and poultry, fish above raw vegetables, for example. So that's a big no-no. And that's often a violation. Somebody gets in a hurry, sticks a pan of something thawing in the refrigerator over the salad greens, and just a few drips of blood from meat can cause a lot of problems. Cross-contamination of that knife.
So that's when you say what cross-contamination means is putting different kinds of foods in the same place. You have to keep them separate because one will cause the other to get contaminated. When it's contaminated, what is it contaminated with? Is that bacteria or what?
And you might be a bit better answer this, but I think of E. coli, Salmonella. Those are kind of our big contenders.
Yeah, it seems like E. coli was the Jack-in-the-Box one, wasn't it?
Yes,
Yeah.
yes, yeah. And the especially virulent one, the H157.
Yeah.
And it was funny. I was working with a situation with some kids making apple cider once, and they didn't know where the apples had come from, and if they'd been picked up off the ground, the risk of contamination is even greater. So I was like, we have to pasteurize this juice before we can let them drink it, the kids. And there was a gentleman there, and he goes, "Oh, it's no problem. I always used to do that." And what I explained to him was that it wasn't until the 1980s that the especially virulent strain of E. coli came about. So when he was growing up, probably people didn't get as sickened from that.
Oh,
so
that's interesting.
bacterias are constantly evolving, and we have to keep up.
So for
Great point.
apple cider, for example, as a kid, if you drank apple cider and it wasn't pasteurized, and it was less risk than it is today.
Right.
So is apple cider?
As long as the apples have been picked off the tree, as soon as they fall on the ground, that's where they can get contaminated from animal feces or other, soil bacteria. E. coli lives naturally in the soil.
Is apple cider, for example, mostly pasteurized that you buy in the grocery store?
Yes, but here in the high country, I know that there's a lot of roadside stands that make apple cider, and it might not necessarily. So it's something to look for on a label. And that's one of the key things when talking about hot food hot and cold food cold, and making sure the pasteurization. Because pasteurization is the process of heating something to a certain temperature to kill harmful bacteria. So it's very important.
And you mentioned that public health looks not only at restaurants, but at trucks and roadside stands too?
Right. In North Carolina, you're exempt from inspection if you're a nonprofit, raising funds for your nonprofit. Although it's a kind of a quirky rule, you can only raise funds through food 2 consecutive days a month or less. But so a fire department cookout is not regulated by the health department.
Okay.
You cannot raise funds, however, for yourself without being inspected. And so that's one of the things that's good to know. I think we're seeing more and more caterers come out of restaurants which builds confidence for me, because when the caterer is affiliated with the restaurants really know what they should be doing. Caterers in North Carolina should be registered. I think that's the correct term. It might be licensed. I'm not remembering exactly, and they should be inspected by the local health department as well. So if I'm looking for a caterer for a family reunion or a wedding or something like that, one of the things I would want to check is to make sure that they have that license or certification, and that means that their facility has been inspected. That can be an issue too. You can have a wonderful a person who's a wonderful cook and wonderful preparer of food, but this reminds me of the food outbreak I experienced several years ago in a neighboring county. We finally called it the wedding party, because we ended up it was actually happened, the wedding was on Saturday, but people started getting sick overnight, and the health department was notified, and it was a wonderful food service event, but the foods got out of temperature and the whole time because the caterer really didn't have the equipment necessary to keep, again, hot foods hot and cold foods cold.
Now, when somebody does eat food that's been contaminated, how soon after that do they typically get sick?
It varies.
Yeah, it varies. It can be anywhere, generally around 6 hours to up to 2 days.
Okay.
You know, I'm reminded of, I was just reading some statistics about the norovirus, you know, the one that goes on cruise ships.
Yes.
This is actually can be spread through food and or airborne. So vomiting reduces aerosol particles and can make people sick. But that one in particular, you can't necessarily kill it from the antiseptic hand wash. You have to wash your hands. You have to wash the bacteria away.
So washing your hands, it's important to really wash thoroughly,
Yes.
as they say from the CDC and health departments and that sort of thing.
Yeah.
When there is an outbreak of some kind, how do you find out about it? You know, so if somebody is at a wedding and a bunch of people get sick 6 to 12 to 24 hours later, and they're living in 12 different or 15 different communities, how do you find out about it, that there's been an outbreak?
That's a great question, and we're always working on that. I think our front line are the relationships that we have at the local level. So while we're so happy to have the guidance from the federal government and the regulatory agencies at the federal level, the local level is where people get sick. And so we try to make sure that we have relationships with the hospitals, the emergency departments, 911, dispatch type folks. So if they start seeing, this is the third person I've taken, you know, transported today. But the other way we find out is through labs. The labs in North Carolina are linked electronically. So we will get a report that we start getting them at the health department reported to us directly from the lab, and about the third salmonella we get is a pretty good sign something's going on. So,
well, so from a individual person's point of view, how do I get alerted that, you know, I might have been exposed and I should, you know, worry about it a little bit?
Well, that is another responsibility of your local health department. When we determine that we have an outbreak, and it doesn't take a lot of people, if we have 2 or more people that meet what we develop a case definition for the illness, then we start doing case finding. And the state, the Division of Public Health, the epidemiology section, communicable disease section will help us with this. But we will do whatever we can to identify cases so that if we can prevent or if we can give any kind of prophylaxis treatment, that we can do that. So sometimes it's easy. You've been at a wedding party, you get the invitation list. Much more complicated at a restaurant, and that's when you'll see the occasional news release that says, if you have eaten at this restaurant in the last 10 days, then call your health department. And I shouldn't ignore the fact that you can call the health department 24/7 if you have a question about yourself. Now, indigestion is not a foodborne illness.
Right.
Well, it is sort of, but you can always report something to the health department if you have a public health concern. And if you're out in a restaurant and you see something that you feel pretty strongly is a violation of food safety, you can notify your health department about that, and we're required to go out and do a problem check.
So now, if I'm at an event like a wedding or something, and I'm getting a sense that, you know, some people are getting sick, and maybe I worry maybe something happened with the food. You said there's certain prophylaxis, preventive measures, which is
Right.
what prophylaxis really is what you can do to prevent it from getting more serious.
Depending on what we think the illness is.
What kind of things would people get for preventing it to be more serious if it's Salmonella or E. coli or whatever it is? What would I do? Would I go to my doctor? Would I go to the emergency room? What would I do?
Well, if you're ill, you would need to see your healthcare provider.
Yeah.
And so that might be the health
But if
department in some
I'm
cases.
thinking of,
but
I've been at a wedding and a bunch of people are getting sick, and I'm not sick yet, but am I going to get
we
sick
call
in
you
6
the
hours?
worried well.
The worried well,
the worried
yeah.
well,
The worried well,
The worried well
exactly.
should call and get some advice. And before you're sick, it might be better to call the health department and get that advice. And
Okay.
if we're in the middle of an event, we really try to make sure the staff answering the phones know how to guide you, and we really try to make sure our website is up to date. We can, of course, make that happen almost immediately and refer people to the website so that just those kinds of things. When should you tip into calling your provider?
And when you say prevention or prophylaxis, what is it? Is it antibiotics or what?
It could be. It would
could be.
depend on what we think you might have. So it'd be very disease specific.
Now, is it a more serious problem for children and elderly like some other problems are, or
Absolutely.
is it pretty much the same whatever your age?
No, it's absolutely more health vulnerable people, young,
Immunocompromised,
yes,
yeah.
young, old, receiving cancer treatment.
So if you were at a wedding and this was happening and you had a 2-year-old, you'd be more worried than if you didn't have a 2-year-old
Yeah.
to do something about it.
They both can get dehydrated. The elderly and the young can get dehydrated more quickly. So that's where they run
Right.
into a lot of risk.
Now, you were saying that there's a way for the health department to get notified.
Yes.
How does that happen? How does the health department learn that maybe there's something happening as a result of someplace, a restaurant or a truck or a wedding reception? How do you learn about that?
Well, if it's not through a phone call, word of mouth from EMS or the communications center or the hospital, then there are really two ways. And one is certain diseases in North Carolina are required to be reported by the lab that runs the tests. So the hospital sends a stool culture to the lab, then if it's a reportable disease, then the lab sends it electronically to the local health department in that jurisdiction. The other way is, I want to make sure I use the right terminology, the North Carolina Electronic Disease Surveillance System, NCEDS we call that, is linked to hospital emergency departments, which is really neat. And so we are able to trend, we can see, for example, flu trending in the course of the year with emergency room data, and local health departments have access to view that data. So that would be another way that we might identify a trend in almost real time.
One of the things that strikes me is, the average person doesn't know the public health department is doing all this to help keep them
Right,
safe.
yeah.
You don't hear about things being prevented. You only hear
That's
about them
right.
when something happens. But
Sort of tapped into one of the challenges of public health. Is
Yes.
if it's working well, you don't really hear much about us.
yeah.
And so it's hard to go get the kind of government funding we'd like to have in place because it's like, could you fund us to avoid problems? It's
Yeah,
a little
yeah.
bit
Preventative.
Yeah.
But that's exactly what the health department does. It's prevention, and people can be their own advocates as well. And I love the comment that you made about if you see something, tell somebody. I've been in restaurants where recently, I won't name the chain or anything, and the sink in the women's bathroom wasn't working. And I couldn't wash my own hands, and so I went and found a manager immediately and said, I'm sure your employees have not been washing their hands, and this is an issue. And so you've got to advocate for yourself, your family. And I had a great question for you, if you don't mind.
Yes.
I know that in studying food trucks, because in my classes we talk about food trucks a lot, different counties each have their different regulations, but most counties do require that a food truck does have, as you said, an association with a restaurant or other established food.
They're not required to. I should quickly say there are no local rules for restaurant inspections or food trucks. They're all state rules.
Okay.
So we enforce them at the local level, county by county, or in our case, Appalachian District is responsible for the enforcement of these rules in Allegheny, Ashe, and Watauga counties. So the enforcement can vary a little bit from county to county, just depending on the environmental health specialists and their training and their quality assurance program and their monitoring from the state. But we really are all enforcing the same rules, and those are from the USDA Food Code. The food there aren't specific. Every food truck does not have to look alike, but there are specific rules that would apply to every temporary food stand or food truck or catering event, those kinds of things.
Now, you mentioned the USDA. That's the U.S. Department of Agriculture. And now, what do they have to do with it? You'd think it's Food and Drug is the agency that you'd think would deal with this, but the Department of Agriculture, what do they do?
Well, we have adopted their food code. It's evidence-based to prevent illness, to protect our community across the United States, really. But North Carolina is one of the states that has adopted that for restaurant inspections. So they give us big picture guidance. They also do a lot of inspections like meat and poultry plants and eggs and milk and that type of area. I'm probably not going to say this very eloquently, but I think of the USDA and the FDA doing big picture work, and then we at the state and local level bring it down to protecting folks at home. You mentioned recalls, which I love now. That's one of the good things about instant media is we can really get the food recalls out. But one of the things that we've noticed at local health departments in the last few years is when there is a big recall, and we have one posted on our website right now for ice cream, and we don't have any trouble with the big chain stores pulling those products off the shelf. No trouble at all. They get direct notification, and those products are gone. But you do have some country stores, convenience stores, kind of mom and pop type stores. So there have been times with products that we know are in convenience stores that we pull our staff away from inspections and send them out to make sure that recalls are pulled off the shelves of those smaller stores in North Carolina.
So if you hear about a recall, like the recent ice cream recall, and you need some ice cream, you might want to be inclined to go to a bigger store until that recall is taken care of, right?
Well, I think you can be confident almost all the time in the big stores that things are not on the shelf that shouldn't be.
Yeah, okay.
So
now, one
pretty
other,
sophisticated.
we haven't talked about food from outside the country. What's the best way to be careful about food that comes in from another country?
What is your perspective on that?
Well, what I like is that we've really enforced some new rules recently that give you country of origin labeling. And I have a lot of friends that are, if this comes from this country, we're just not going to eat it. But there's huge oversight issues that we really need to, it's not teased out yet.
Okay.
So I think you have to really take it on a personal level, and whether or not you want to take food from other countries, but at least we now have it on the packaging, so we know.
You know when it comes from some other country.
Right.
But you should be careful about it at least.
I think, and certain countries have better regulatory standards than other countries, and that's probably not for topic here, but
It's a
definitely
bigger,
there's enough on
more
the web.
complicated question.
Yeah, it's definitely a big
Now,
issue.
to kind of bring it back to those of us who have picnics and barbecues, what advice can you give us when we're going to have a picnic or a barbecue and it's a warm day, and what do you suggest we do to be careful and make sure that we don't create problems?
I think the top four are wash your hands often, everybody, throughout the day. Hopefully you can have places where you can wash hands, and if not, at least using wipes, but keeping your hands clean, keeping, as you were saying, raw meats away from other foods that will not be cooked. And when you were talking about the meats in the refrigerator, people put the packages of meat from the store just on their refrigerator shelf, and they don't realize that the juices can come up and leak down and underneath, and then you've got a pool of contamination, and then you just go and put something else right on top of that space later, and you can have cross-contamination there. So you want to keep the contamination, cooking to proper temperatures. Absolutely is a big one. And then if you're going to have leftovers, refrigerate them really rapidly and make sure they get to below 40 degrees as quickly as they can.
So use plastic wrap or put meat, especially meat, in
Yeah.
containers that are closed, not just on the shelf. Because I mean, I
Yeah.
know I've been guilty of that. It comes in the, you know, the
Yeah.
meat wrap paper,
Right.
and I just put it on.
Yeah, I always
didn't-
put it on a plate.
Yeah.
You know, just it's
So a
the
plate or
easiest
put it
thing.
in plastic wrap or
Right.
something.
Well, for
Don't
the
just put it up.
picnic, yeah, put it
Yeah.
in a,
I mean, I did that this
plastic
weekend,
container
as
with
a
a
matter
lid.
of fact. I'm not thinking about it.
Yeah, it's easy.
Keep your ice
Yeah.
separate if you're cooling down, if you're going on that picnic and you're cooling your hamburger meat over here, don't get your drink ice out of that cooler. You know,
Yeah.
we've come so far in coolers.
Yes.
That I think that's an investment that the picnicking family should make, is
Yeah,
to have
yeah,
adequate
yeah,
coolers.
yeah.
Right,
yeah.
right. And, you know, ice, people do have a tendency to want to eat the ice later versus the blue
Oh,
packs.
don't do that.
Yeah, no, that's
Because you might have the
definitely-
meat in there, it might have
Right.
contaminated
And
the
you don't know
ice.
how many other little hands might have
Well,
been
sure,
in there.
that's also true, yeah.
Yeah.
But that, then little hands
Yeah.
that didn't wash very often.
Exactly.
Right,
yeah.
okay, okay, all right.
Yeah.
Well, thank you both for being here. This is so important to all of us, you know, we don't want to ruin a picnic.
No, no.
And there's more to talk about, so we really appreciate it.
Thank you.
Thank you.
I'd like to invite you to join us next time on Health Talk. I'm Dr. Jay Noreen.